to the public. Joining us for that discussion this evening is the relatively new Chief Executive Officer, Neil Clark. Good to have you with us.
Good evening, and thank you for inviting me on.
Absolutely. Here on set with us, we have Communications Specialist Shane Seeley.
Always good to be with you, Teshia.
Always good to have you back here on CBC's Couches. And Director of Nursing Services, Henderson Pinder, is joining us remotely. He's online. Good evening to you, sir.
Teshia, and I'm pleased to be here with you.
All right. Well, we're going to start the discussion after this brief break. Of course, we encourage you to join in the discussion as well by calling us on 228-5562 or 228-5563. The People's Business gets underway after this. Top for Welcome back to the People's Business. As we mentioned, we have the CEO here with us and, of course, the communications specialist in studio and online, the Director of Nursing Services at the Queen Elizabeth Hospital. I know it's much pressure when we start talking about the hospital, but you're relatively new, so you're 6 months in. Let's start by talking about what you've been able to accomplish in these short 6 months.
Thank you. So in the first 6 months of me arriving here, I wanted to listen. I know people like to talk, but I wanted to listen and listen deeply to what was happening inside the hospital. So I bit my lips for a whole month and tried my best to say nothing and listen to what was happening and what the people were telling me. We took that then as an understanding of what's happening in the hospital. It was clear that I needed to understand better how the hospital operated, and we produced what's called a governance framework, which actually outlines all the different committees, the role of the management board, the role of the directors in the hospital. That's an important document just to explain how do we operate, what do we do, who's accountable for what, and how do we make decisions. I then wanted to understand how well is the hospital performing, and we developed what's called a balanced scorecard. These are not new in the healthcare world, but it's the first one in Barbados. And the balanced scorecard gives an overview of how well the hospital is performing at a given time, and it trends that over the months, so you can identify trends as to whether something's improving or something's deteriorating. And it's broken down into a number of areas. Care delivery, so how safe are we, how efficient are we, how caring, how responsive, and how clinically well led are we. Infrastructure, workforce, IT, and financial sustainability. So we've developed now the start of our a balanced scorecard to enable us to track how well we're doing and where we need to put interventions in. It's early days. It's been a challenge collecting some of the data. As you'll know, we don't yet have a health information system. Much of the data is manually collected, which is a challenge to make sure we collect it in a timely manner and even to ensure the quality of that data that we're collecting in. The next step then now is to move forward into, now we have the governance framework, how do we operate, how do we make decisions? Now we have a balanced scorecard, how are we doing? The next step now is to design the strategy for the next 3 years. And that strategy is being drafted out by the directors. We're currently consulting with the staff. It followed the flow of the previous strategy and what's called a commitment for excellence, which are targets that have already been promised by the hospital to the Ministry of Health and Wellness. And that strategy is now being consulted with the staff, and it follows that same alignment the care delivery, the infrastructure, IT, workforce, and the staffing. So that document's a live document that we're working on currently with the staff. We've taken it to our own town hall. We've been speaking about it on the radio shows on Monday mornings, and we'll continue to push forward with finalising that strategy so we can identify what our next steps will be.
All right, that's quite a mouthful. It sounds like there's lots happening. There has been much happening throughout that 6 months, that short 6 months. But I want to jump online now and go over to Mr. Pinder to talk about the state of nursing, more or less. We heard the Prime Minister announce recently that there are going to be some new nurses coming into Barbados. Before we even talk about that, though, what's happening in your particular area of the QEH? I know this is one of the areas that comes into focus much of the times in terms of service delivery and being able to have the amount of nurses we need to deliver the quality of care that we need at the hospital.
Good evening, and thank you for the question. The state of nursing is well at this time. What we have done is we are using the strategic plan that Dr. Niels just expounded. What is happening there, we have used that to streamline our goals for nursing. And one of the important goals is the goal of ensuring that we have the right workforce to deliver the care at the quality and the consistency that we need. As you would be aware, and if you've said, the Prime Minister has given us the mandate to ensure that we have that staffing. And we have gone to Ghana. This is our third occasion to do so. And what has happened? We are recruiting nurses from there. We are also optimizing the nurses that we have here in Barbados by employing all of the graduates from Barbados Community College. And where possible, we are trying to encourage persons from other places to join Barbados. So we have a national and an international recruitment drive. What that allows us to do is to enhance the quality of nursing care, promote the health and the well-being of our staff and our patients, be better able to communicate with them, and to strengthen our research and implementation of innovation and what we call the community projects that we are working on.
Well, thank you so much for bringing us up to speed on that. Let me just mention that there is a delay in Mr. Pinder hearing us and himself, and that could be a part of why he is speaking in such a slow manner. But that all comes down to the technology, so bear with us this evening. Remember, you can still get on the telephone lines, 228-5562 or 228-5563. We most certainly are going to allow you to come in on the conversation. And Shane, I would like to bring you into the conversation at this point in time, Mr. Seeley. Of course, when we talk about the Queen Elizabeth Hospital and all the work that is done, it always goes back to where people go to, where we talked about nursing, about the, accident and emergency department. How are you tackling that through the new initiative in the radio show? It's now in its second season, but
Indeed.
For a lot of people, this is unprecedented in terms of being able to relate and engage in discussion with medical practitioners as well as people in the medical field in such an intimate way on a weekly basis.
Yeah, it's all about bringing the information to the people. I know in previous times it may have been a bit difficult to hear some doctors. You would only hear their name, But now, through the radio show, we have all of the medical professionals coming through, all of those who are working at the QEH in different specialties. We had that on the first season to share the information that Barbadians need. In season 2, we're focusing a bit more on the 2025 to 2028 strategy, but sharing with the public how this strategy will enhance the hospital to work better for them, to work better for the staff, and to work better in the interest of the country, because as you know, the Queen Elizabeth Hospital not only serves Barbados, we have visitors coming to Barbados, we serve our regional neighbors as well. So it's all about enhancing the profile of the Queen Elizabeth Hospital. We know that there has been a perception that the public wants addressed of the QEH. You mentioned the accident and emergency department, but my CEO has brought in some new plans, and I know that he will mention a few of them from his expertise across the world, bringing them here to enhance what we do in the accident and emergency department. We have a 10% increase, and again, CEO will expand on that in staffing. The Prime Minister would have announced many of those staff complements that we will get to address a number of areas that may have been lacking in the past. So the Queen Elizabeth Hospital in the next few years will be at a place that it has really never been before. Of course, the Minister of Health has been working very closely with us to make sure that these things become a reality. And I can tell you this, Teshia, with all that has been said about the Queen Elizabeth Hospital, I think that going forward, Barbadians will see a different QEH, which is more service-oriented, which is about breaking down those barriers of communication with the public. I had a call this weekend from a lady, you know, she wanted the information, and it's a bit more readily available now. Just call 536-4800, and we have our doctors and nurses manning the patient advice and liaison service, more commonly called our help desks as well. So it's these things that we have now as tools to really engage with the public, as you said, Teshia, in a way that we never did before. The radio show, you know, people call with their concerns. While we are talking about the strategy, people have their individual concerns, and we're still able to handle those, you know, and when we can't give you the answer at that point in time, we tell them, give CBC producers your contact, because of course your information, your health information will remain confidential, and then we make that contact after, so that we make sure that everyone who has concerns re the QEH, coming through the QEH, we can manage them in a more timely fashion than was done previously.
And Teshia, just to add on to that, it is a public hospital. We're there to serve the public, so we have to be open and transparent and accountable. And it's really important, therefore, that we come back to the public with the plans, and we test those plans with the public. And it's equally important, as said before, that we listen. We listen and learn, and we hear what they're saying. So Mr. Steele is doing a great job at helping us communicate outwards, and we need to keep receiving that information inwards. And we've often said on the radio shows, and we can say here on TV, you know, if people have something to say, if people have a complaint, let's hear it, because we can't investigate it if we don't know about it. Equally, if people want to say something good about a member of staff, let us have that, so we can feed that back to them. There are a lot of staff in that hospital working really hard and doing the best for the patients, and we need to feed back to them when they're doing well, as opposed to just feedback when there's a complaint. Our complaint rates are very low. Only 0.02% of activities result in a complaint. Now, I don't believe for a minute that there aren't more complaints out there. And we encourage people to let us have that information when something's gone wrong, as we encourage them to let them have the information when something goes right. But every time something goes wrong, and it only has to go wrong once for you, for your family, we need to respond to that, and we need to address that as carefully and compassionately as we can, and investigate to make sure if we can avoid that happening again, we do avoid that happening again.
Well, based on what you told me at the beginning of our discussion, you talked about a health information system that you're hoping to institute going forward. I would imagine that this will be very information heavy as well, to be able to more adequately do what you do. Talk to us a little bit more in depth about that particular system. Sure. And exactly when you're hoping for it to come on stream.
So that health information system is the patient database. So at the moment, all the patient records are held on manual files. And if somebody's ringing in trying to ask about their own file, or a doctor's trying to access a file, depending on where the file is, it might be hard to get hold of. The health information system will take all that data in those patient records and put it onto a software system. That data will be searchable. We'll be able to easily access that data, and we can access it from multiple points at the same time. Multiple doctors or staff can look at the same health record at the same time. That